So I'm here presenting the patient case of Rue Robinson. The patient's chief complaint is that she feels bad. The patient is a 2-year-old African American female who is currently receiving induction chemotherapy. Her past medical history includes acute lymphoblastic leukemia. Uh, there's no pertinent family history. Social history is that she lives at home with her family that has a dog and 6 chickens. She has no known drug allergies, and the medication she is currently on is Bactrim 240 milligrams. It's 5 milliliters to 3.3 milliliters BID on Saturday and Sunday. Chlorhexidine 0.12% oral solution. Swish 15 milliliters by mouth 3 times a day. Uh, Donsterone 4 milligrams per 4 milligrams per 5 ml oral solution. 2 mils by mouth every 8 hours PRN. Dexamethasone 2 milligrams POBID. Famotidine 10 milligrams POBID. And then she's also on a vitamin D plus calcium supplement, 1 tablet by mouth daily. She's up to date on all of her immunizations. For her review of symptoms, she did have a fever of 34.9 degrees Celsius, and she has redness around her port site. For her vitals, her blood pressure is 100/28, heart rate 118, temperature, as stated earlier, is 39.4 degrees Celsius. Her respiration is 25, height of 73.7 centimeters, weight of 10.5 kilograms. Patient's BMI is 19.3. Patient's BSA is 0.46 meters squared. For her laboratory data, her CMP is within normal limits. Her CBC is within normal limits except for ANC, which is 90, which is extremely low. Her creatinine clearance is 56, and she had central, peripheral, and urine cultures taken. The problem stated for this patient is febrile neutropenia. The evidence is her temperature of 34.9 degrees Celsius, ANC of less than 100, redness around the port site, and the rationale for the chosen plan is based off the NCCN, the IDSA, and the Stanford guidelines. The goals for the problem is to relieve the patient's fever and eradicate the infection with antibiotics. The drug regimen is 2 drugs, cefepime and vancomycin. The cefepime dose is 500 milligrams IV every 12 hours. For 48 hours past clinical improvement. And the vancomycin is 160 milligrams IV Q 8 hours, 48 hours past clinically improvement. For her safety monitoring, you want to monitor renal function, and for the vancomycin specifically, Redmond syndrome, and then monitoring parameters for her efficacy and improvement is that she's afebrile for at least 24 hours with an ANC of greater than 500, negative culture results, her blood pressure, and her respiratory functions. Thank you.